So, our question today comes from a young lady who says, how do I fix sad looking eyes? Let's bring her picture up that she used for her question. Sorry for the darkness. But as you can see, on her lower eyelid, she's got kind of this downward slant where you see more of the white part out toward the corner than naturally you would see on average. That can be normal, meaning the way she was born, or that could be something in the makeup of how she was born that gives lack of support or doesn't allow for appropriate support of the eyelid. Again, she's born with it, but if it's not causing her distress, what I mean by that, it's not causing tearing because this is too exposed, the eye is irritated, it's not causing irritation or redness of the eye, then this is normal anatomy for her. Now, this means that if this is the case, she just doesn't like it and this is a cosmetic procedure, which is okay. So, if this is a cosmetic procedure or if this is a functional procedure where she does have tearing, irritation of the eye, and threatening of the eye because of the irritation, then we would want to lift the corner of the eye. And one way you can do that is called a canthopexy. This little corner is called the canthus. A pexy is actually just pexying up, meaning just tacking it up. So underneath the skin, you can kind of make a teeny little incision, get underneath the skin, grab that, and tighten or tack it up. That's one way to do it. That's a very simplistic explanation, but that's one way. The second way is through a canthoplasty. Again, the canthus is this little corner. In that particular procedure, you actually detach the little tendon that attaches the lower lid to the bone of the eye socket. You lift that up and reattach it to the bone, and it lifts that corner or that portion of the lower eyelid. Those are great procedures when used in the correct situation. If you use it in the correct situation and they have symptoms like we outlined, then those symptoms should improve. If this is something that she wants for cosmetic reasons, then it will improve her cosmesis or her look. But she has to accept that her eyes are now going to be smaller. And sometimes people can't wrap their mind around that when their eyes have always been kind of big and sad. They don't like that. But when they're smaller, they don't like that either. So you really have to sit with the client or the patient and make sure that they understand that expectation. So, certainly ways to address it. We definitely have to set expectations. We have to make the correct diagnosis. So that's why it's really important, as I say all the time, you have to meet with a board certified plastic surgeon. And in this case, you can meet with a board certified oculoplastic surgeon, which is an ophthalmologist, has done extra training specifically for plastic surgery around the eyes, eyelids, etc., and sit with them and get a good examination, a good, kind of understanding of what the doctor can do or can't do for you. So, consultation and evaluation is always warranted in any situation to make sure you get the best advice. So follow ESJ Aesthetics. That's my practice where confidence takes shape. We'll see you next time for another question. Take care.